God is with us, as the name Emmanuel implies. God is with us. As we are starting with this program, we know that there are a lot of people on their way coming, and we are praying that God will take them here safely in Jesus' name. So I'll keep on speaking English concurrently with Chi, so that those who don't understand the English, we can understand the Chi aspect of it. So our topic for today is on cancer. In the program, Patron and any Yare friend program, one when we say cancer, do you understand the meaning of the word cancer? If someone has any answer to that name or that word cancer, the person can raise up his or her hand and give me the meaning or the understanding to that word cancer. So let's say Kokramasia. Out the Kokramasia. And which me am on Sassono or Mammy Chetri. A son, 7 with I tia, Yamba Hasi, Yaba Mamma, and you should get a Yama Chetri, no Suyi, Yentia, Kokram body person. The Abeya found one yen Yapokram. A son said himself Kokram by a swat. You knew it through the you beat me, I answer the source. The source are not so I know just say you from the fear. Boom said, when it's very told, not at all. So when we say cancer, as we don't have any treatment for it, we do palliative care. And palliation is a form of treatment in which you just treat the symptoms, once you leave the causative agent or so you are just treating the symptom while the person is still suffering from the disease, the underlying disease, which is the cancer. So in America, to see a cancer or crown, your nipediano, your yeti, your con, your book, your yim, your na, your don't pay your muja. I am you move a quarter for Sunday, the other Sunday. Your way, your way are some. If you don't offer me piano, a bit to me up a private yama. As we know of the word cancer, cancer can affect any part of our body, starting from head to toe. So it can affect your head, your eye, nose, mouth, neck, chest, lungs, stomach, every part, even the blood, the bone. So you know, as you know, cancer can affect any part of your body. So it's a very dangerous and risky disease. Inti, Mr. Raymond say, cancer. Yeah, dear, you could hear. Then you're very boy who buy it. So if you know that cancer is a very dangerous disease, what are you going to do to prevent it from happening to us? Intimi, Numa is showing me a trace cancer. Intimi be and find it in simple pine. Say, by a soil, intimi simple pine. Last month, breast cancer awareness month. Last 2 months, prostate cancer awareness month. So who are here? Only says I did a man is also. Last month, last month was breast cancer awareness month. Last 2 months, prostate cancer awareness month. And the opinion said, you phone program, and then your prostate program. I have one last, but so you and it yet you echo. So, being say, yeah, one church of human is also. And see, I said, I just say, yeah, train away with green. Oh, Abraham. I just said, yeah, straight. So it means that we are really mixing a lot of things up in our life, especially the educative aspects. So last month we dealt with breast cancer. So I'll elaborate more on breast cancer. So when you say breast cancer, it doesn't mean that if you are only female, only it implies to only females. Males can also get breast cancer because we all have breasts. So if I say breast cancer, and just say a Maya realm for me man so betimi enya breast cancer. It's an say be more about obiara. So it's been known that with the breast cancer, although it's very common in female, if a male presents with a lump in the breast, about 100% of it, almost 100% of it, will be cancerous. Then you say breast cancer, no, a idea what it may. Now, obey ma, so when you idea say big down, you for man. In preppy, you know, a cancer. Unlike the female who might have a lump in their breast but won't be cancerous. It is said in Mayma, Madiano, waiting you are woman from you so can get cancer. But Bayma, there's only be a woman from Nina almost 100% cancer. So it means that we as male should also take breast cancer very serious. Just say yes, so yeah, you may man. I see a fat breast cancer. No, did you ever do no? You fan and in your day so. So as I said earlier, I'm speaking little about breast cancer. We have risk factors for every cancer. Risk factors for every cancer. You only will break tumor cancer. So since I said we have risk factors for every cancer, I'll give you a gist about risk factors for breast cancer, risk factors for prostate cancer, risk factors for leukemia, which is blood cancer, risk factors for throat cancer, risk factors for lung cancer. So since I said cancer be or the other. Nti me church nyoma e de breast cancer ba nyoma e de yahrawa cancer enso ba kokramba nyoma e de buja cancer enso ba nyoma e de prostate cancer enso ba nyoma e de yemi cancer eba. So let's start with breast cancer risk factors. So with the breast cancer risk factors, it's known that people who are obese, obesity is one of it. People who takes in alcohol, who smokes, family history of breast cancer, especially if you have first line relative who came with breast cancer. Your sister had breast cancer some time ago. Any family member within the first line, your sister had breast cancer, your brother had breast cancer. You should take it very serious. People who ingest a lot of fatty foods, oily foods, you should also take it very, very serious. People with any history of smoking, as I've already said, people who have been taking a lot of alcohol, as I've already said, and people who are westernizing. Westernization means that because of urbanization, we are being exposed to other agents, radiations. You know that we've been using a lot of phones, which makes a lot of radiations. We work under environment or work within environments whereby we are not very safe. So the air that we breathe in, we are being exposed to a lot of infection, a lot of things. Senior American breast cancer risk factors are those. But my mom, I created with breast cancer. One, we did study and degree. I can see obesity. No smoking. And I say, be or your ban or Bema, not or your relative. I say, nephew, my papa, and on my back. Not so young breast cancer. Also, what do we need cancer by a mouth risk factor? A mouth, a fossil, until it means cancer. So, still on the breast cancer. So, it's also known that senior mechanics said, senior year or mine or air personal, and also to be the Yari in my virus. The sons and I say, use phones, and you will be phones me by it if I need radiation. You will be able to queen, and it's to you to be as I am going to be back. You see, risk factors in the doors. So still on the breast cancer, it's also known that aside the alcohol intake, aside the intake of the smoking of cigarettes, which we can categorize them into primary intake, primary smokers, secondary smokers, tertiary smokers. So the primary smoker, let me explain it further. Primary smokers are those smoking the cigarettes themselves. Secondary smokers are those who are inhaling the smoke from someone who is smoking. And tertiary smoker is something like buying, assuming that you smoked, someone has smoked in this environment, the person is gone. You've also come to sit within that same environment, to a tertiary smoker. So it's also a form of smoking. So the person finished smoking, the person is gone. You came to that same environment. Because of the saturation of that benzene, nicotine, and those substances within the air, which are still not yet cleared, and you come and sit within that same environment, you are also smoking. You are a tertiary smoker. So in a medical treatment, you say smokers, and not just say, will be on cigarette in fan as well smoking cigarettes, or a smoker. Into primary smoker said you perform answer just with chair and one or three, you say the cooling, on all direct impacts. And a secondary smoker here, Obia, young fans are no alarm for bit, no alarm for no, or no scout your own you, but or no good so. Well, by a secondary smoker. And I have felt a share for the tossing me, son, a tertiary smoker. Tertiary smoker, you, yeah. Young fans say, Obia belongs guys to us in all. Or cool, only had you, but also have name. Now, so we are wide. It's answer I'm from any no smoking room, no. I am called infant me. What's why they sushi. Is any offense, tertiary smoke. So as I've been saying, as I said earlier, the other causes of cancer. So let's come to the risk factors for prostate cancer. So with the prostate cancer, as we did last 2 months, with the prostate cancer, it's only in male because known that females don't have prostates. The prostate cancer, may program one, and the enca in man because a man will be prostate. So the prostate cancer, there are also risk factors. Being a male is a risk factor. That's first one. Second one, being exposed to a compound called cadmium. So cadmium is a compound that mostly we neglect because we don't know where it comes from. We mostly find them in the light oils, kerosene. So chronic exposure to kerosene, gasoline, petrol contain cadmium. When after using them you don't bath regularly. Let me say after using them you don't bath, the next day you are being exposed. You need to increase your risk factors of getting prostate cancer. Aside those who work with batteries, the car batteries, whether commercial or private. And when you go after using the car battery, you have to wash your hands. As soon as you wash your hands, you are free from the cadmium. So that one, if you don't do that frequently, the cadmium compound can enter into your system and increase your risk of getting a prostate cancer. That's one of the second aspect of the risk factors of prostate cancer. Then other aspects are those who are sexually active. So who have, even if you have multiple sexual partners, will also increase your risk of prostate cancer. And there are also factors which are also not known, because it can also occur spontaneously to everyone. Assuming that a person had, let's also consider this aspect as well. A family member with any issue of prostate cancer also increase your risk of getting prostate cancer. Likewise, the breast cancer. In the end, American account, prostate cancer risk factor they do on my they do on the name no. One, we obey man one which mean prostate cancer. Two, what they know be a tumor. I won't show you which mean prostate cancer. It be a compound cadmium. Cadmium no ye new yedi so can ye and where is so can a bit say kerosene, a bit say petrol, a bit say gasoline. And said, Sanya only go a become, sir, and I said, and next one now be a shear. No, I'll grow oh, ye, wow, from now, what's why you do mana? I saw more fitting. Air cost out to be near possess cancer. Now, some said, wouldn't you be using your possess cancer, and also a man or risk for Canada, apostle. And I sound so young friend, so be. And so I'm on me for many batteries, on me a cage man or batteries, no. Whether say a commercial, what the papa said, and a wow car, no, your battery moving man. The SODS or one, sir, which are coffee, yes, or one. Now, one yes, sir, I was in the winning. Why, yes, I did change your prostate cancer, and the winning over years, woman, and the prostate cancer, and so so other risk factors for prostate cancer are. As we knew for the breast cancer, alcohol intake and smoking as well. I've already explained, elaborated on smoking and the categories of smoking. You might view everything in the breast cancer, I see or more on side, and I sound somewhere then. Almost change jobs. So smoking the medical alcohol. So that it's a main change. So the other cancers. So next month will be a month of cervical cancer. I don't know whether we know of it. So cervical cancer, it's also peculiar with female because males don't have cervix. Nti yare a etimi kan ma awodie no ano no. Eye adia and also now bosu ya ba ko signal. They become one asem pan your boss something. Esante and a man for yari na yet member yari. Esan say a man awodiama, mema muni awodiama. So the risk factors for cervical cancers includes one being promiscuous, have a lot of multiple sexual partners, having yourself exposed to virus called human papilloma virus. Where do we get this human papilloma virus from? One, we get this human papilloma virus from one, being sexually active. Either you yourself being sexually active, having multiple sexual partners, or you are having a partner who is not faithful. The person, you know that you are faithful to the person, but the person is having multiple sexual partners. So the person will go for the infection and bring it to you. And see, cervical cancer, risk factors maybe, I'm not say, cancer now, but I'm not you will be intimidated by a young one, or moon name me my babo, and a young town, money me man town. See, dear, you know, about season in the home made my doors. If you want to know, or Bema about when I Bema about when some of my doors. In the sound, Bema about a fire, it's about a fire at the outdoor bar. And all do all Obama, what they all say Bema about when I was not Bema door, might be free. What fire at the outdoor. And only risk one of the risk factors for cervical cancer. Cervical cancer, with the cervical cancer, it's known that there's a cure if diagnosed early. That's the only cancer known to have a cure if diagnosed early. That's why we'll be creating awareness for next month. But if not diagnosed early, there's no cure. So you say cancer there, program there, you know, I know it will be now. In my audio, no program dear. See, who in term dear, the betting island. It's Yano Pine. The betting I'm on heart or cry. It sounds a new thing ever come once and was soon a bit papa shoe. Now, ye did kind of mamma, near Churchill and son, I was soon out to sing. So, there's cervical cancer. We will talk about symptoms for all the cancers. So, that's for it, that's a gist for the cervical cancer. So, let's come to the lung cancer. As I said, we have various organs which can develop, which can be cancerous. So with the lung cancer, there are also risk factors for lung cancer, and there are a lot because as even as we are here, we are inhaling gaseous substances which we can't see with our eyes. Nti ya hrawa kokram no ade so pese de boss kakra ya hrawa kokram no ade a etimi ha ma ne mema na se hawa edi so so bebre ba so na ya hrawa ya re no ya lance ya re no ni o bebre etimi ma ne ba be ba go bo so yet here a ni aye home home ya fa na eko the lands. Now, into your review from when you might eat by him, and see a movie. So these are some of the risk factors for the lung cancers. One, smoking is the primary cause risk factor for lung cancer. Aside smoking, be exposed to chemicals. So initially I mentioned cadmium. Cadmium is not a risk factor for lung cancer, but we have other chemicals like the asbestos, arsenic acid. We have nickel. They are all risk factors for lung cancer. So where do we get the asbestos from? Arsenic acid from? So the asbestos, they are those, especially those who work within the factories, who produce tiles, they use the asbestos. So exposure to those fumes from the tiles over an extended period of time can predispose them to getting lung cancer. So those working with tiles and those POP, the things that are used for POP, those working within that company who are being exposed to those chemicals, the arsenic and asbestos used for asbestos for POP over an extended period of time can also predispose them to getting lung cancer. So in a medical lung cancer, if you say so, no cigarettes in one year, you want cigarettes. It has a 1 hour, and as a different good so, and as well, but maybe a moment. And yes, I'm ready prayer. It's in my own and say, if you look you will be so bit me. I'm a young program. A dear, a mom, ye, companies, I can say, some more year tax, more year, new TNG. You will be away few. Some chemicals no using company no using company they no using ah mutimi kun to mu ko mu na akojina ma kra wan na ma mo kaye breast cancer with lung cancer. Yeah, questions maybe ever come as into be able to question answer. Mama read few questions so what do you feel okay, but
you can say one of the daughter, there was a quarter of a person, they need the patrol. My father said, we have and I'm cabin, and I'm going to get every year the jack fire. Near the way to say, we see now, so go to Abba.
Okay, so me check you. Scary to know. Your new young day. A Janus wa a son, and you will. No money be scary to me. I was scary to me. Ah, no, but I didn't be now a gen. And see, dear, wait me, I did a friend, Yari a friend, COP. We do my old jump one. COP by an cancer. I know one. Me and I say, and COP. And now I want to see. But not yet answer. But no one was guaranteeing. I bet me a moment. I don't think I sang up in an army now when you're in your You're one of the years, scared from the year, and the encounter cancer. But I'm so on you might be to me. Over time, and why will you sue for over 20-30 years time? Now, son, a bit tired. I will be anything at time. I won't say none or 1 hour boy. That will be, I don't say any tea, I'm on the tea. So we've already explained some of the risk factors for the risk factors for lung cancers are many. So you want to leave that one. So let's come to the blood cancer, the leukemia. Last 2 years, I had a patient, a young guy who came with a symptom of dizziness. So you have to transfuse. So after transfusion, you know that after transfusion, the blood should take a minimum of, let's say a maximum of 3 months for a new one to come. You produce a new one by yourself, your own blood, so a maximum of 3 months. But with this guy, after transfusion, I realized that 3 days after transfusion, he started complaining of that same symptom again. So we extended it to the next week and repeated the blood test again. And the blood was low again after giving 3 units. How possible? Where did this blood go? So we gave another unit of blood the following week. After another 1 week, 2 weeks, 3 weeks, the blood was gone again. So good morning. So realize that so where did this blood? Is it that there is a sieve in the blood, such that the blood won't stay within that person? So realize that it's not because we are giving the blood; it's because the person is having a blood cancer, which is a leukemia. So there are also risk factors for leukemia, which I'll make mention of. So let's continue with the risk factors for leukemia. One, working with radiations. Radiations, you know that we are in an era or in an environment whereby we are exposed to a lot of radiations. God being so good, the radiations that comes into our system is able to get rid of it. What about those that the system is not able to get rid of? And it stays within us for a longer period of time. That radiation, which we are not able to get rid of, will start affecting the bone marrow. And with time, the bone marrow will now become cancerous. So where do we get these radiations from? Now we are in an environment whereby we can't dodge radiation. Even the phones that we are using radiation. Even the direct sunlight on us, the UV lights on us, we are being exposed to radiations. And we, those health workers who work within the X-ray units, we are being exposed to radiations. But God being so good, the radiation that we are being exposed to are minimal, such that, so the phone radiation is minimal. Minimal such that it won't give us any effects. So over an extended period of time, we won't have the chance of developing the leukemia. God being so. So the little radiation that the phone produces, the electromagnetic waves, and the radiation that we are being exposed to in our environment, the system can deal with them. So it will get rid of it. So you are free to go. So what about if the system fails? The system fails, that's when you will start having you start developing the leukemia, the blood cancer. And we those who sleep under high tensions, we are being exposed to a lot of radiations. The high tension poles, not the one that connects your room directly, the high tension poles. So if you have a building under a high tension pole, over a period of time, the radiation that will be emitting over some period of time will let you develop leukemia. So we realized that the guy was with his parents and they were under a high tension pool. So it means that he has been exposed to a lot of radiation, and the system wasn't able to get rid of it. So you have to refer the patient to Kompanochi. Unfortunately, Kompanochi too did what they could, but he didn't survive. So that's it. Not to make anyone sad. It's when it comes, you just that you have to pay to go. But we can't do anything about it. We give you medications. The medication is just palliative, as I said earlier on. They are palliations, just to treat the symptoms, but not for cure. Nti ka kokremu etime ha ye moja. Unu say moja so betime akokram. Kokram timi ha ye moja. Nti moja so betime akokram. Nti kokram bi a etime ha ye moja, friend leukemia. Leukemia ne hu ni say ni we bi a friend radiation say fi your phone e use no. Obi a de bia e fan so ye dwuma e hwe. O try hwe. Anya ya ye me dwuma o mom ye dwuma e hwe. Department no. Also omnya radiation. And I'm that high tension pool as it. And they said, oh, dying. And it's nice, easy to follow. Make sure it's high tension. You will check a canal, they will watch your life now. Now that the high tension is found down through it sounds so better down there. What down then, radiation with high tension. I will be there. And say, go with the now, much program. Nti yenya yare ku bi oba e ho Ghana hospital on no sir there's teens ni nti oba ni man moja nyama ni nsa nyama moja ni nsa ya ho moja ti man ni nsa bese na wotwe ba ku mi no na moja na e de ba ni nyina asa e wo ni nti ese man moja ni nsa biu na man moja ni nsa biu na wotwe mi no biu na moja ni nyina asa. Yeah, money means I do. Into best, I was so back. I'm going to ask. Tamuja best at night. I want to hear you say, Beside you, who said that, and we didn't come in. See a man of four. Now, our host and so good for one to see it. I knew and no feel. Into high tension to say without dying swat, a young fire. Into your nipa now client say, even say high tension pool, and I said, phone will you sure? It's me, he's animal, a few, if you begin with me, he's animal. I will never jump. Now, some say, if you didn't mean, say, if you are now they will come a day back. And say, a idea I had so, we've elaborated some of the risk factors and some of the cancers. There are many of them. So we have the cancers of the kidneys as well. And with the risk factors for cancers of the kidney, it's not known. It's not known, but people are saying that maybe when you are taking contaminated water with those mercury, gold, you know that when those who have been doing the Galam state, they pollute our waters. So when you're taking those contaminated water with mercury, those who are not taking the sachet water, but they are drinking from direct source, the streams, and which are polluted with those heavy metals. Being exposed to those metals also gives you a risk of developing liver diseases and may lead to some of the renal cancers, renal cell carcinomas. And see, you will say, "Proclaiming her a son, and not yet." Then to me, she won't ever get what's your money back. Now, the one says, the piano, or more I can say, you swear a knee and your face. Amata said, metals will be on the glass if I know. Now, this one said, you have not son or one man and so nada. Now I say, you know, what's saying the son of metal? No one and one. It's me, between one, or son of one. You see, this were cancer. And so let's come to some of the things. I've already mentioned some of the cancers. There are many. As I said earlier on, this can affect you from your head to toe. So let's elaborate some of the symptoms of cancers. When you are developing cancer, who knows that I am or you are developing cancer? No one knows. But there are some symptoms which will indicate that this person might be having cancer. And those symptoms comes in when it's getting too late. And some of the symptoms include anorexia. Anorexia means that you are not eating at all. No matter the food, no matter the amount of money that you have, no matter how delicious the food is, you can't even eat the food. So you don't have appetite for food. And with that, you start losing weight. So, and since you are losing weight, your blood will also be dropping. You become anemic. And it's known that with the cancers, some of them, when it starts in the initial phases, they stay within one particular part of your body where it started. And with time, it will spread to other parts of your body. So if they are within one particular part of your body, although invasive, they are localized. Invasive means that they can spread to other parts of the body. They can invade underlying tissues. They will invade underlying tissues, move to other tissues, and destroy them. That means that they are being invasive. Then, when they get to other parts of the body, they call it metastasis. So, with being invasive, so let's consider the cancers that I've already mentioned one by one. So, with the breast cancer, so when the breast cancer starts developing, what do you see? So the localized lump, or you get to know that there is a lump in your breast. The breast cancer, you get to know there is a lump in your breast. And that lump might not be tender. It means that it might not be painful. It means that some may be painful, others will not be painful. You will see that the lump will start increasing rapidly in size. So that's with the breast cancer. Rapidly in size. Over a shorter period of time, start increasing. Now it will start to become very, very painful. Some might not even see any lump within the breast, but the person will see a dimple in the breast or a retraction in the breast. Some might see a discharge. The person is not breastfeeding, but there's a discharge from the breast. And the discharge could be blood-stained discharge. It will be a greenish discharge, brownish discharge from the nipple. Some might also see a nipple retraction. Others might see enlargement of that particular breast. So it means that the breast cancer has started, although it has not spread to other parts of the body. So if you don't take any attention, when you don't pay attention to it immediately, and it spreads to other parts of your body, you can't do anything about it. So with the breast cancer, over time, over a certain period of time, it takes a longer period of time for it to spread. Although it's a bad thing, but that's the good thing about breast cancer. It takes a longer period of time for it to spread. So when it starts seeing these symptoms, immediately you have to report to the facility for us to do something about it. So when it spreads, what do you see? One, it spreads to your bones. So you start having bone pain. So back pain, chest pain, it spreads to your lung. You start coughing. It can spread to your brain. You start having confusions, seizures, even weakness on one part of your body. It can spread to even your bone marrow, reducing the blood that you've been producing. So over time, we can't do anything. When this continues for a long period of time, you have to do a palliation, which you can't do anything about it. Palliation, I've already told you. Into medical breast cancer. Into then, say, when you have breast cancer, then I bet you have to say when you have breast cancer. Medical cancer said, Oba, I bet you have breast cancer. Into breast cancer, but then I bet you say when you have breast cancer. If you want now, you look for what you get a chamber. If you want more, you say, maybe there are no food. I didn't die from and do not die from every time I am young and I say, yeah. I don't just say, no, yeah, your breast cancer, your young said, say, your breast cancer. You need it to move on in human. If you want to for and lose and so over, you soon or mark a pretty food. You soon I so free, you food ever. You soon if you from neighbor. A bit to me, I, Muja, a bit to me, I, from Swa, any anything. A bit to my side, a bit my green, a buying color. If you bet me, I brown. Now, when you from so I don't know, bet me apple. As I can also feel out when you from answer bet me apple. Now, shall say, yet, see it. Now, women son, that's what the bar hospital intended. One hospital intended now, there may be and found one. Women said, not a depot. Into a depot, my friend, bet me apple, a big kind. Bet me up or how when watch as I say, oh, walk one. Oh, 1 years so. Now, so add say, won't me now we just also add say. Now, a bit I also bet me up or don't be the ones I don't pay on a year. No, we also senior be kind and then we also a buffalo. You see, as I've said about concerning the breast cancers, let's come to the cervical cancer, the second cancer that I mentioned. So the cervical cancer, as I said earlier on, only affects women, female. So when it starts, how do you know that you have cervical cancer? So with the cervical cancer, one, the person might have a discharge from the vagina, a discharge. So the discharge, not just a discharge. This discharge will be offensive, it will be foul smelling, and might be stained with blood. So anytime you have an intercourse with your partner, you start bleeding. So as soon as you, after intercourse, you see, anytime you see bleeding after intercourse, then it means that you are having a cervical cancer, or the initial stage of cervical cancer. You have to do something about it. And so if you don't do anything about this cervical cancer, what could result? One, it will spread to other parts of your body, as I mentioned. So first, it will spread to your bone. So you'll be having bone pain. Your blood might go down. It will also block the ureters, where after receiving your blood, you will come and store the blood in your bladder. So because I've blocked the ureters, you feel like urinating, but you don't even feel like urinating. Sorry, you don't even feel like urinating. Your abdomen will be distended, so your abdomen will keep on being distended over a period of time, and the urine that you produce will be very scanty. And over some time, aside it blocking the ureters, it will also spread to your lung. So you start coughing, have difficulty in breathing. After the difficulty in breathing, it will also spread to your brain. Then you have a weakness on your one side or your whole body. You come with seizures. Inti kokrameti enya imama aseno awdiano ebi nie se ni wa bena se ba utimu sa ya oba we do na kokrampo na se one so we say you so be fi oba no say so be fi na se ba na nso le nka wo nso na aside say nso le nka wo nso no moja ewo anasa so ni be me hye bia na moja on sa minu hye bia moja aba o nso na enye so obu ni nsa o oni moja oni kun hye bia na moja aba o mu ni sa ta oni hye bia na moja aba na chere se onya awodi ano kokran nti se wanye bibia amfa ho betimi atena bibia ni bebi betimi ama bibia Johnson fa Johnson na fa no ebebu oblada ni Johnson twani no eno kwan be si Johnson bi an nti wo do sabe Johnson kutu ebi na beba wo ho na wo yi funa chance se hye beka so bia bo bia so na e mo bia fun bi funa hye Johnson na beta wo na wa ya se chance se yo ya nti when say oba na ntuma na mo bia na betimi akọ na hra wo bi akwa na no okọ wa no means so na akwa bi na ama ne fa say no ai adodo nti ntimi nante wo ho ana esro aka no nti ti ko dompe so wo sana dompe mu ye ne ya na mo jan so ye de bafu. Nti let's come to the prostate cancer. So what are the symptoms? You know that, as I said, with the prostate cancer only affects male because females don't have prostate. So when you get prostate cancer, what are the things that it should? What are the things that will indicate that you have prostate cancer? So one of the things that will show that you have prostate cancer is hematuria, bloody urination. As soon as you are urinating, you see blood. When you see blood after urinating or during urination, you should be very careful. Maybe you are developing prostate cancer. One, the other things include frequent urination. After urinating, urinate at shorter intervals. After urinating, 5-10 minutes time, you feel like urinating again. You go urinate. You don't get adequate to just small amount of urine will come. Maybe 30 minutes time, 15-30 minutes time, you feel like urinating. You go to the loo to urinate. You just get a scanty amount of urine coming out. You should be very careful because you are developing prostate cancer. And prostate cancer, it's known that it's age dependent. After the age of 40, every male after the age of 40 should screen for the prostate cancer. After the age of 40, you should screen yourself for prostate cancer. So that if you're able to detect it on time, it's also one of the things that we can also cure. If you're able to detect it on time, we can do something for you so that it won't spread to other parts of your body. So that you live your whole life, your lifespan, you have your lifespan in full. So these are some of the symptoms. So you urinate at shorter intervals, you'll be having bloody urination, you feel like urinating all the time. And if it keeps on spreading, at times you urinate and the urine won't be flowing well, so it will be dripping. You strain before you urinate. And you'll be urinating, you'll be having intermittency. So you urinate small, and small will come, the rest will be retained. You feel like you've emptied your bladder in full, so you have to go and urinate again. So with time, it also spreads to your bone, and particularly with prostate cancer, it spreads to your lumbar vertebrae. So you have waist pain. So waist pain, if you don't do anything about it, you get fracture of your vertebrae. So when you get fracture of your vertebrae, you can't walk. And it also affects your manhood, so there won't be any erection. You can't walk, there's no erection. Then it means that the cancer has progressed. And this can also spread to other parts of your body. It can also go to your lung, it can go to your brain. So when it gets to your lung, you'll be coughing, you have difficulty breathing, producing hemoptysis, that bloody sputum. So, and I make a because the next you make me explain how much is here. Say, you are really why it's more than so. It was sorry, you not be some item so. A bit me up, I say, and a bit of a saying, you know. Be out or down, wouldn't so be free. Wouldn't so be free, a bit of a so. Let's say you but I'm so be free. Now, say, what I'm sorry, you know, so. A bit me up, I say, one, or woman, go to the yama. The sounds up when I said, Pompey, pushing with jam, put the baby and be free. Now, the baby and I, and also, when you wait, we are going to know about money. Not one half of which I see with any now, Pompey. It's a money to me, yes, sir, with mana. Which I get tired with the jammy papa. This is a jammy papa, and I hope you sweet journey for me. Since when they journey, if you know, go down for dying, what down. Now, so in our shall say, we will son, a tree sounds good. No, shall say, what you saw. Till you may now, so you retain nothing happens of us, 3 and 4. And she said, we are to feel on what I did. Because it's you know, across I don't see everyone wants to so baby. One, it does all so baby, internet more so, and I say, you're waiting up, I say, my area. Waiting up, I say, poor diabetes. It is a prostate, and I make a prostate problem, or prostate problem. Every time I say, one, the I say, when you have prostate problem. The brain, yeah, say, or just a woman as a job. So much I create what you say in my as well. What best die away? I saw it in 92, which is your channel, so you check it, it's my young. If you also hear in few on Kakra, when Papa Ojonsa, Kakra, not Ojonsa, a craving ever. Kakra just saw them. Not what you so view. Kakra just saw them. Not what you say, or you in your prostate problem. What's it to run? Say, I don't just say we have cancer. Which I say, who have cancer? But what I say, who have cancer? Cancer, but it's when you're in say, did no one. So now they are very cancer and cassava. Into the area, is a one. But you so also out to say, Jones or you. Why don't you say we calculate Johnson and batting a back as a source? A source on a woman, I just oh, what you say. So what is a Johnson in the arcade? Johnson one juice, also out to say, Johnson said one you say. Until I cannot do sort of know what you saw. Now, what you saw open swap. Now, you know, I came there. I know a different from, I know this soil, prostate enlargement, BPH. Prostate enlargement and prostate cancer. I said, one thing a year, who more better said, when you have prostate cancer, no prostate cancer. But what the best, what the diet I saw any better, it's my teaching say, we have prostate cancer, we have prostate cancer. And see, the other things a bit to me, the other, yeah, this is what I bit to me actually say, oh, you have prostate cancer. If you say one, 200, now say, what you saw, Kakapana just at Marco, just around this one may one by me and you arm. Now, Yarana Coswa addicted to no one. I bet me apple, don't know which you want to eat your ya. We see don't pay on a ya. We see don't pay say, oh, yes, Sarah, I said, when it's going to an more. Who are not a boo. Indeed, a boo won't mean nancy. Was a one man when you are put it over problem by soon to me nancy, and I put it cancer. The book because as I say, remember, don't pay no, you just don't pay no. With time, one went to an army, so don't pay no. A boy, I will one. Bring man so 18 months sorry. What matter say? Until you do the Musa one up there at 10 apple, not an apple. Until I call Lance, no, I shall say for what we are from Muja. And then I just saw one boy, Muja won't be an prostate problem. You go on TV, Timor Boa Muja. I put it so. Problem now, it's not called around my lunch, no steam mamma, yes, sir. Take you, son, it's not quite dreamer. I've been out doing so. You can be a kind so. Into so. Into a demo. Son, woman out now. What a joke, father joke. I've been 20 mounts, I 20 mount, 9 years, said, you put it that. 20 mounts, as well. Oh, one that's not a crack. Let's say, and you do it 20 minutes. It's the only one who said, so I said, Kakra do so, that's all one year issue. In the sun, in the say on one. And we did if you are 40 years. That could be that's all Banny show Muji. No one said, what's the problem? Oh, yeah, and I saw me. It's as I say, it's me in Tama. It's me, it's I'm not fine. Wow. Yari is sensitive, you see, I'm fine. Intent empire. And as a one, but not the Jim, it's no baby and yes, it's no part. It's me actually found you. The area they will do, who by a moment do. You do know, say, among what of a cream pay. Now, yes, so now, it's one sitting more. So, likewise with the breast cancer. So, it's recommended after the age of 35 years, you have to be screening. You have to be, if not every 3 years. You have to come for the screening. We have 3 therapy for breast cancer. One is the clinical assessment, and 2, we have the mammogram and the cytology. So the clinical assessment, because of the issue with population, we've advised that if not at all, you should you can do self-examination. So being a female, every day, every 1 week, you can examine your breast to see if you are developing any deformity in your breast, so that you take precautions about what is happening, safety precautions. It is something here about program. And I want more so the man teach you, no man say, and telling you by a young swat, if you buy a food, say, yeah, you'll be high. Yes, yes, it's unsaid, Sika Sample yet. They say, I give piano, you feel me, said piano. That's all about hospital. Yeah, show you. No one said, be and queen, if you could. Now, this son say, you can't. Says I can't say, I said, Mumba, in the sun, say, be ya, walk as Oban, wow, Oban. I give ya, I saw it. We yet wow, self examination. Now, self examination, no bear. Who say you are now about the Toswa? No, why is that mean? Go look for until you pursue me and wait me as I mean. Much I say, yeah, I come. Till who say you mark, so who say you know. Not about why then? Why share? When you find I say, yeah, I come. So with the lung cancer, I've already talked much about the lung cancer, because most of the primary cancers have secondary metastasis to the lung. So medical can know about the power cancer. The son said, cancer be the lungs are around. So with the lung cancer, these are some of the symptoms that you'll be noticing. 1, you'll be coughing, you start coughing. You'll be losing weight, you can't eat, and you also be anemic. So the cough will progress over a period of time, irrespective of the amount of cough mixture that you take. It will still not be resolved. And because you are coughing, you're producing bloody sputum. The sputum that will be producing will be coming out of your cough, will be blood stained, and you have difficulty in breathing. And over some time, you have swelling of both feet. And if this keeps on for a longer period of time, it will also spread to other parts of your body. And with the lung cancer, it has what we call the paraneoplastic syndrome. It also manifests hormonally elsewhere in other parts of your body. So even though you have lung cancer, you'll be having Cushingoid syndrome. So we have particular rashes on your body, the whole part of your body. Aside the rashes, you start developing pot belly, buffalo ham, moon-like face. So those are symptoms of the Cushingoid syndrome. And one other paraneoplastic syndrome of the lung cancer is the polycythemia. This is similar to the renal cell carcinoma, in which you'll be having a lot of blood production with quality. Because of increased lipoids in your body, you will have a lot of blood production. Even though we said renal cell cancers will lead to anemia, with the renal cell carcinoma, you have abundant blood, RBCs, which are not supposed to be so. Also with the lung cancers and the renal cell, they have paraneoplastic syndrome. So the paraneoplastic syndromes are symptoms that you manifest, but they are not directly related to the cancer. See, Yara program and a medical outcome. You will be to man. Now, I said, I don't have a program. Then I will see among Miss Winner. One of the boss says, over one so we are which are now so air, sitting to me, no more so air. Bohua say, Mumia is so, and so between Anthony Apple, maybe it's a meeting called meeting called living, and why I done this. When I realize how far side the other, to know if it's meeting, it's our how program. Inti cancer idea, inti cancer idea. Inti I say you share who you pa. Inti you share who you na a bar. Inti medical boss say one. Omo me eduma of companies. Omo use them. Omo use them. Chromium, asbestos. To tiles. Omo tile company. Omo use asbestos. Omo to develop lung cancer. Omo use chromium or light oil, kerosene, gasoline, petrol, and also omo to cadmium, or kerosene, petrol, gasoline. Air content compounds cadmium. It's more prostate cancer. It's me and some cancer. So what did you now would this are they be also yeah can see it and so Tima and also Tima intestinal cancer. Most of the timina cancer. So, sorry, that's all short, so I get with you. And so this are David Bray. So, this are the intima with some cancer to me, colonic cancer. And also, won't you know, and to me to Mount. So, as I've said, with the cancers, I've already mentioned a lot about the cause and risk factors. Let me add this one to the cancers with the development of colonic cancer, colorectal carcinoma. It's known that people who ingest a lot of fatty foods, who does little exercise, and who are obese, are at risk of getting intestinal colorectal carcinoma, which is intestinal cancer, and it also has its own manifestation. So you should also be mindful of the diet that you're taking. So that's why we are here to be checking your weight. You do your BMI. To ensure that you are within the minimum range, you are within the optimal range. So if you are becoming overweight or obese, you are advised to appropriately. Anything you want to say, you see the woman said, if you are near obesity, who did you study the degree? Now it's normal, you can see ultimate and anything you want to say. Until you check your weight, where you will be answer, I check your sugar. You won't say. So, yeah, can see me too until 2 4, no alpha, 19 out, no young snow program. It sounds on snow program was not. I hear me about more components, or scapan or young snow program. Scam 18 years. Yes, you are not training her, so sunset. It was not to be so I did it brain or. So I had a patient at Confanochi who presented with colocarcinoma, which is intestinal cancer. The person was very wealthy, has a lot of money, but the money couldn't save him. No, irrespective of the drugs and the things that the person bought, the patient bought, he was still not able to be saved from this cancer. And eventually, the patient died. So you should also be mindful of the diet. So we should be taking fatty foods. So we should advise ourselves on adequate intake of fats. We are not saying that you should refrain from taking fat. You can take the fat, but it should be in minimum. It should be to the barest minimum. You shouldn't take a lot of them. You can't refrain from it totally. You can't stop taking fat. But some people, even when doing lights, they will pour fat on it. They will pour oil on it. But I think it's not a good practice. So we should also refrain from it. So that's why we are here. You try and see your weight, try and check your RBS, check your BP, do all the counseling to find out if you are having any risk factors, so that we advise you appropriately. Okay. So these are some of the things that you'll be doing. If they've already started doing the anthropometric measurements, we'll be doing the counseling as well. So we are urging everyone to partake fully to the benefit of the individual. Thank you so much. So when asem kakra I can say the ade ehia nti eso bi ade no hye mu nti the no check your weight go on san right chance na ye no akasa nti ye no kasa wie ye betu fo na acha de obesa o ye de so nti o kwa o fi ano de aye eduma intimidating abua so the answer. If there are some questions you can ask.
I saw a video where someone said this roasted meat that we buy from these people that roast on the roadside, that it has a, well, like we are under risk of getting cancer. I don't know how true it is because they explained that maybe from the roast from the iron they use. So like eating it brings risk of cancer. So I don't know how true that is.
So any other question? Let's add all of them. More questions. But to go the same here. Questions?
Multiple partners. Is this over one partner but having it regularly? And now I say, oh, 1990, they in this album.
Okay. So let's tackle the first question. You see, the Okayam, it's been shown, it's known that smoking fishes also poses a risk. It's a risk factor. It's a risk factor for developing cancer. And this risk factor depends on what the person used for the smoking. So, assuming that the person was using rabbits, the person used rabbits to do the smoking. The person bought charcoal. The person used the rabbits to start the fire. And the rabbits are still in. So you continue with the smoking. No, there are chemicals in the rabbits. And I think that one, I think it poses a risk of lung cancer instead. You have a risk factor for lung cancer. So when you eat that smoked fish, because of the chemicals from the rabbits, which has gotten into the meat or the fish, you introduce yourself to acquiring the lung cancer. So it's a risk factor. So not all smoked fish, not all smoked meat, but it depends on the agent that you use for the smoking. And not that notwithstanding, it's also known that some smokes, even if you don't use the rabbit, some smokes also increase your risk of getting the lung cancers. And that one is not well documented. But it's very minimal. And for you to get a lung cancer or a cancer from smoked meat or fish, then you have to be eating the smoked meat or fish for a long period of time. Maybe 30 years, 40 years, using that same agent, the rubber and those things to do it. A long period of time. Not that you go eat and tomorrow you get the cancer. No. And the question with America. Robert near Koto winner. You do good. A chemical near the year. It's a chemical needs you rubber and with your new man. And hard. But if you feed your new man, if you rubber near put anything hard. They benefit you having a feed rubber now put one ocean. What's an ocean? I was on the mountain. I mean, give me so down the rubber nest. Now, rubber new normally. We're not to smoke. I'm not the air one now. Not chemicals, need to rub it never. But you want to say, especially the white one. Or the black one is not advisable. Because the chemicals never rubber in any case compared to the white one. White one is still continuing. But the black one, Kaka was a black one, the one, and you know, air. 18. the chance to chemical need film. So chemical need film no could be any here when you
Doctor, what about using plastic cup to make tea with hot water?
So using plastic water to make tea, it's also not a risk factor. It's not a risk factor. So it's because the rubber is stable. So you are not burning the rubber. It's just a container. So when you pour the tea inside, it can't release the compound from the rubber. It's just anything that will melt, assuming that it will melt, if the tea will melt the rubber to release the compound from the rubber into the tea, that's when it will pose a problem. But if it can't melt it, it's not a problem. And the issue with multiple sexual partners, if you have one partner alone, but having multiple times of sexual intercourse, it's not a risk factor. That one is not a risk factor. So you have one partner who is faithful, and you don't have the person is not having the risk factor for cervical cancer, and having multiple affairs, it's not a risk factor. But the risk factor only comes in when you have a partner who is not faithful. So you have one partner, but the partner has partners. You get it? Or you, the individual, you have partners. You get it? And that increases your risk of getting a cervical cancer. For the female. Thank you so much. So if there are more questions.